people about the shot. So I just had to take a break and come and do this interview. Thank you so much.
All righty.
Alrighty. Okay, so excuse my background, Dr. Vanchiere.
Mine too. Mine's not good. I think let's see if we can get a little better for you. That better.
Okay, I think I could see a little bit more. It's a tad bit dark, but we'll work with it. I see your
Not
eyes.
bad.
Okay, so um, tell me your thoughts on what's going on with the Johnson and Johnson shot.
Right. So as the FDA has reported, they're recommending, pausing use of the vaccine until they can explore this side effect that's been seen associated with the J&J vaccine. They've reported 6 cases of severe blood clots in fact, occurred in women. And that's out of about 7 million doses that have been delivered in the US. So about 1 in a million cases has this associated side effect. And this is exactly what the FDA is to do, is to protect us in all of our manufactured, biologics and vaccines and medicines of any issues that arise, and to investigate them so we can learn more.
And so, what does this mean for the people who have already received this shot, maybe a month or so ago, or even last week? Didn't you guys have
Yeah,
a clinic last week?
we did. We administered about 600 doses, maybe 650 this past weekend at the Brookshires Arena. So for those folks, FDA is recommending, what we know about the cases that have been reported is that those blood clots occurred within beginning about 4 to 6 days after the vaccine, and out to about 3 weeks post-vaccine. So they've asked that anybody who is within 6 weeks of a J&J vaccine to please, be particularly vigilant, be aware. And if people have severe headaches, shortness of breath, or tingling, numbness, or lower extremity weakness in particular, they should be evaluated by their primary care doctor or in an urgent care setting. Just make sure there's not a blood clot.
And what about those people who genetically have issues with blood clots already and they've taken this?
Yeah.
Should they be nervous?
At this point, again, we don't know, and so there are a lot of things that do increase your risk of blood clots, and genetic factors are one of those. We know smoking is one that increases risk. Oral contraceptives also increase risk. So there are a lot of questions still to be asked about the 6 cases that have been reported, and I suspect that FDA and CDC will be. They are doing that already and asking those questions on all of our behalf, so that they can then let the rest of us know what they found in those cases, and explore whether there may be other genetic factors or immunologic factors that play a role. We know that the COVID sickness itself, when it's severe, tends to have clotting as a problem, and so whether that's related or not, again, we don't know yet.
Have you guys had any calls from people who may have taken the J&J who were kind of concerned after
We've
taking
had a
this?
few, yeah, we've had a few calls of folks concerned, and so that's part of the reason I want to, get the message out, and echo what FDA has said, is just be vigilant. But again, this is a rare event. It's a 1 in a million event, as best we know at this point in time, and so that's the right step.
Now, this is kind of the second event with this particular vaccine. Last time it was a drug mix up, and then now this. What do you think this means for some of those people who haven't taken the shot?
Yeah, I think that, well, again, there are a couple of things. One is that we know that there's still a good many folks who have not been vaccinated who are eligible, and some of them it's logistical reasons, they're working or unable to get their vaccine. But for others, it's hesitancy or really complacency, that they're just tired of this pandemic, and have had enough of it and decided they're not going to get vaccinated. I think that vaccines, these vaccines are still very safe, very effective, We need to learn more about the J&J vaccine to be confident to go forward, to turn the switch back on for that. But remind people that masks still work very well, better than vaccines that we have. So everybody has a responsibility to themselves to keep their health good, but also to the ones they love and other people they don't even know to be vigilant, wear your mask, good hand washing, and social distancing. Those are the key things that we know work, and there are no side effects of those, and that's what folks need to do.
And have you guys had any more doses of the J&J and now you can't use it, or were you planning an upcoming clinic and now you kind of have to
Yeah,
replace those doses?
we have put our J&J clinics on hold for now. We'll continue using the Pfizer vaccine and Moderna. We have a little bit of Moderna. We'll continue using those, but we won't be doing any more J&J clinics at this point.
How many clinics did you have an upcoming clinic that you kind of had to cancel because of this?
We have 3 or 4 things that have been in the works. One is that we were planning to use the J&J vaccine at the Bayou Classic for vaccine competition between the 2 schools involved there. But in talking with public health, we all agreed that it's best to cancel that event.
Alrighty, and so what kind of happens to these doses? Do they just get thrown out?
Well, right now they're basically, the doses themselves are quarantined. We keep them, and they won't be used. They have a very long shelf life, so it's going to take a few weeks at least for the FDA to sort all this out, and we'll just keep them on hand until we have specific directive from CDC or FDA on how to move forward.
Alrighty, and is there anything else that you'd like to add to, let people know that it's safe to still get the other vaccines and anything like that?
Yeah. Yeah, as I said, the other vaccines we have a very good supply of the Pfizer vaccine, and encourage folks to go ahead and get vaccinated and continue with the masks and good hand hygiene and social distancing that we know are important and effective at controlling this pandemic. We've got a long way to go still.
Alrighty, and thank you, Dr. Vanchiere, for taking
All right,
time out
Taylor.
today. Thank you.
Anytime. All right,
Bye
take
bye.
care.